You can't cure Crohn's or colitis. Even today, they'll say the same. There's no cure, right? If you're on medication, you know you're sick and not getting better. Everyone, hope you're all doing well. This is going to be a super quick video because I'm not going to waste anybody's time today. Also not looking to offend anyone, but this is the reason why I'm a carnivore. So, I don't know if you can see that properly. That's an ostomy bag. I wouldn't recommend it. It sucks. You've got to carry it around everywhere and drag it around everywhere with you. Sleep, exercise, work, making love, whatever it might be. It's not just a physical thing, you know, like this affected my mental health. It led to severe depression. Lucky for me, I found the carnivore diet and that cured my depression. I've nearly had to wear that for almost 7 years. The reason why I have it is because I did have ulcerative colitis, diagnosed probably 5 years before I lost my colon. I was struggling, you know, went to the doctors. They had no advice, no help other than we have drugs for that, like they always do.
Drugs are bad. Okay.
I saw a few different doctors, and not one of them asked me about what I ate. They didn't say, hey Lee, we've just diagnosed you with colitis or Crohn's, for example. What is it that you eat? Let's talk about what you eat on a typical day. Do you drink alcohol? How many meals? Do you cook your food thoroughly? Just meaningful questions that you would think that they would be asking. Here's some drugs, you'll be all right. 3 years later, that happened. So I have no colon anymore. I would certainly try and avoid it if you can. This is aimed mostly towards people that suffer with Crohn's disease and ulcerative colitis. So IBD, but I do also believe it affects everyone because we're all humans and we all have the same kind of digestive tract. I feel like I have the answer to anyone that's suffering with Crohn's and colitis right now who may even be on medication, that they won't have to flare over and over again. Maybe not once again in their life, depending on how bad you're affected and how affected you are in terms of like, is the disease spreading or has it kind of gone too far kind of thing. So I'm going to cut straight to the chase here and say that it's not necessarily the reason why we have it as a predisposed genetic weakness that can be triggered, but it is triggered via the consumption of fibre. The reason why this is fibre does not break down. So if you have, for example, like myself, problem in your colon, right, that's in your digestive tract, the food you eat is directly going to impact that. Same as Crohn's, which is even worse, I would argue. It can affect anywhere from gum to bum.
From gum to bum, the digestive system.
It's harder to diagnose, it's harder to treat, and probably way worse to try and perform surgeries on too. So we're basically talking about the digestive tract. We have a weakness there, so foods directly impact that. Everything in animal products can be broken down, digested, absolutely no problem. How do I know? Because I've eaten every food I can think of since I've had this bag. I would say that you absolutely should think about eradicating all carbohydrates out of your diet. It's probably the closest thing out there to a cure. If that sounds like just so unreasonable, impossible to you, then I would at least recommend massively restricting the most fibrous carbohydrates. So things like strawberries, cabbage, celery, nuts, seeds, raw onions, and pineapple, mango, things that just, I mean, if you eat a mushroom, however you swallow your mushroom after you're done chewing it, that's basically the state that it's going to enter your colon. That's going to inflame that vulnerable spot. I just think that the people that are suffering with Crohn's and colitis right now, you know, a lot of them are in the dark about nutrition and why they're suffering the way they are. And they're desperate for help. They don't know that fibre is like an antagonist. It's their enemy, that you don't want it in the diet. Some people will get away with this. Lots of people will get away with eating fibre every day. It doesn't mean it's good. It just means it's less bad, right? Vegetables and fruits are supposed to be really healthy. I even thought this like not too long ago, but what's healthy about them? Where are all your essential proteins? Where are all your essential fats? Where are even the bioavailable micronutrients in the right ratios that are actually bioavailable, like not beta carotene version of vitamin A, or like retinol, which is the real vitamin A that we would like to absorb, right, found in animal products. These people deserve a real answer. Like, they deserve the truth. And I'm not saying that the doctors are lying to them. It's just that they're on this like autopilot mode where they're just prescribing. There you go, there's problem solved. Next. I don't know. There's something so wrong about that. And we've all been trained to think that way as doctors. And as patients, we're trained to prescribe and be prescribed to. We're not trained to go, well, let me look at the diet and figure out what is the culprit. Like, why don't they just think about it for a moment, like this is a disease that affects your digestive tract. So food is got to be one of the most important things to address, right? What do you eat? It's like a distraction. It's like you go in there with a question and you come out with a drug. That's not an answer. It's really strange. And yet that's become so normal, we don't even think about it. We don't question it. We feel convinced that we're on the path to better health. And that's a load of old nonsense. If you're on medication, you're sick and not getting better because you're ignoring the cause and you're just treating or masking your symptoms. You can't just address your symptoms on something like Crohn's and colitis and expect to be okay. Here's some drugs for life, which is going to incur more drugs and more drugs and more drugs and more illnesses and then more drugs. It's absolutely absurd to me that that's the way they're trained. They're trained to think that way. So for the most part, they don't have bad intentions. They've been misled themselves, and then they're on this strange path to not helping anyone and treat their problems. And I do believe the answer to their problems is eradicating at least the most fibrous carbohydrates out of your diet. Eat less meals. Imagine you're eating 5 meals and they've all got fibre in it. Your colon, your ileum, your small intestine, your duodenum, you're having very little break. There's nothing okay about that. But yeah, it's not a coincidence that all the obstructions I've had with the bag have always been carbohydrates, right? Brown rice and broccoli was a problem. I had celeriac, cabbage and carrots all grated up like sort of rabbit food as a side, and that clogged me up. It was a big problem. And mushrooms too. Those were the 3 obstructions, but I have had 0 obstructions on an animal-based diet. I don't know why people think that the gut needs fibre. Like, without fibre, you can't have a healthy gut microbiome. What a load of old nonsense. Your gut microbiome will change along with your mouth microbiome every time you put something in there, right? And if it's going to be different, then it will change. The biota in your biome will change accordingly, the way it should change. It's adapting. The body knows what it's doing. So when you're on one diet and then you change to another diet, your biome is going to change, but so it should. And if it does, then that's an indication that it should. I don't know why we're trying to control our microbiomes. That's insane. Like, if we really knew something about the microbiome, which we kind of don't, then okay, fair enough. But what do we really know? At the end of the day, I haven't eaten any plants for nearly 8 months. I mean, I don't even have a colon, so my microbiome is like, what, non-existent? Yeah, I'm alive. Or it's relocated somewhat in my ileum and my small intestine. I don't really know. I don't think anybody does. I haven't eaten any plants in 8 months. I don't seem to have any problems. All I've had is improvements. I feel better without my colon than I did with my colon. And that's not because I eradicated my disease. I mean, I was depressed because of this afterwards. That's another thing that you might want to consider, is that there's the physical element, which sucks. But that affected my mental health dramatically. And the carnivore diet cured that. I have other videos addressing those if you're interested. I also have a mini documentary on plants, which you might want to go and check out. I've just tried to be as helpful and concise and clear as I can about addressing pretty much every plant I could think of and all of the toxins and certain fibres and problems within that particular plant. So that might be helpful. Everything that I mentioned in that video as well is not bro science. It's all fact. You can fact check everything I say. It's not based on epidemiology. It's based on fact and real meaningful science. So yeah, hopefully this is helpful. Please share with anyone you know who's suffering with Crohn's and colitis. They're horrible diseases. Fibre is the main issue that once eradicated, hopefully all your problems with Crohn's and colitis is gone too. And that's what we want, We don't want to be on medications for life. We don't want to be losing body parts. So there you go. And also drop a comment, anything you like. Tell me I'm an ugly idiot. I don't mind. It doesn't offend me. This isn't about me. I've been through this. I've done it. I've seen it. I understand. I've been up and down, here, there, and everywhere with it. It's done. That's me. That's my fate. I can't go back. But these other people, there's something that can be done. Like, comment, whatever it is that you want to do. Just helps push the message out to a wider audience, and so we can help more people. Appreciate it. Thanks very much for watching, and take care. And if they were to sit them down, like, who's just eating meat and eggs and fish and dairy? It's a very small community, okay? We're not a cult. I'm not part of any cult, okay? I don't get paid anything. I'm not following anyone. I'm following me and truth and my gut, right? Pardon the pun.